Welcome back to the channel. We brought you the today, November 12, 2023 info. I will announce the topic first. Examining the complexities of Israel-Gaza conflict, a critical analysis. Al-Quds hospital in Gaza forced to close amidst Israeli attacks. Let's move on to the detailed news. Examining the complexities of Israel-Gaza conflict, a critical analysis. In the midst of an escalating conflict between Israel and Gaza, the role of journalism in shaping public opinion and understanding cannot be underestimated. However, it is essential to approach the coverage of this complex issue with nuance and objectivity, avoiding biased narratives that may perpetuate further suffering. In this analysis, we will assess the recent segment aired by CNN's Jake Tapper, its implications, and the broader context of the conflict. Tapper's segment opens with a recognition of the tragic loss of innocent lives in Gaza due to Israeli strikes. The images of devastation and the growing humanitarian crisis are undeniably heart-wrenching. While Tapper acknowledges the dire situation, his proposed solution raises concerns. He suggests that Israel should continue its military actions and bear responsibility for the humanitarian catastrophe, attributing blame solely to Hamas. During the segment, Tapper features Queen Rania of Jordan, who argues against a ceasefire, claiming it would endorse civilian casualties. Tapper responds to her remarks with a condescending tone, questioning whether Hamas foresaw Israel's severe retaliation. However, it is crucial to note that calling for a ceasefire amid an ongoing Israeli onslaught, which has claimed thousands of Palestinian lives, is a valid concern. Assigning blame exclusively to Hamas overlooks the broader historical context of the Israeli-Palestinian conflict. Tapper employs video clips, including those from the Middle East Media Research Institute, MEMRI, to draw conclusions about Hamas. While these sources are widely known for their pro-Israel bias, it is essential to critically assess any media outlet's agenda, including those on the opposite side of the spectrum. Tapper presents three assertions: Hamas willingly sacrifices Palestinian civilians, disregards their protection, and aims to perpetually attack Israel. However, these conclusions may oversimplify the complexities of Hamas's motivations and disregard the underlying causes that have fueled the cycle of violence. Tapper briefly alludes to the issue of prisoner exchanges, suggesting that the international community fails to propose a solution for Israel to retrieve its hostages. However, recent surveys in Israel indicate substantial support for a prisoner exchange, which Hamas has repeatedly offered. It is worth noting that such exchanges have occurred in the past, underscoring the value placed on Israeli lives. The segment's focus on the point of view of Israel neglects the broader dynamics and potential avenues for resolution. While Tapper's analysis has garnered praise from some media figures, it is crucial to approach the coverage of the Israel-Gaza conflict with a commitment to impartiality, accuracy, and comprehensive understanding. The complexity of the conflict demands that journalists provide a nuanced perspective that considers the historical, political, and humanitarian aspects involved. By doing so, we can contribute to a more informed and constructive dialogue that strives for peace and justice in the region. In related news, Al-Quds hospital in Gaza forced to close amidst Israeli attacks. The escalating Israeli attacks on Gaza have led to the closure of Al-Quds hospital, the second-largest medical facility in the region. The Palestine Red Crescent Society, PRCS, has reported that a fuel shortage caused by ongoing bombings has compelled the hospital to cease operations. This development raises concerns about the safety and well-being of medical staff, patients, and displaced civilians who relied on the hospital for critical care and shelter. In a statement released on Sunday, the PRCS emphasized the challenges faced by Al-Quds hospital due to the relentless Israeli bombardment. The depletion of available fuel and power outages have severely hampered the hospital's ability to function. Medical staff are now resorting to unconventional methods to provide care amid dire humanitarian conditions, including shortages of medical supplies, food, and water. The PRCS holds the international community and signatories of the Fourth Geneva Convention accountable for the devastating impact on Gaza's healthcare system. The complete breakdown of medical services and the ensuing humanitarian crisis have placed the lives of Palestinians seeking treatment and shelter in grave danger. Tommaso Della Longa, spokesperson for the International Federation of Red Cross and Red Crescent Societies, expressed alarm over Al-Quds hospital's isolation, with no access in or out for the past 6 to 7 days. Al-Quds Hospital is not the only healthcare facility grappling with dire circumstances. Al-Shifa Hospital, another major center in northern Gaza, has also closed its doors to new patients due to Israeli bombardment, fuel shortages, and a lack of necessary medical supplies. The blockaded hospitals in the northern part of the enclave are struggling to provide adequate care to the increasing number of injured individuals. This alarming situation leaves the wounded with fewer options for medical treatment, exacerbating the already dire consequences of the conflict. The dire circumstances have forced medical professionals to take extraordinary measures to treat patients. One plastic surgeon at Al-Shifa Hospital revealed that they had to place premature babies on ordinary beds after the bombing damaged the incubator unit. In an attempt to provide warmth, the limited power available was used to adjust the air conditioning. Ashraf al-Qudra, spokesperson for the Gaza Health Ministry, condemned the Israeli attacks for terrorizing both medical officials and civilians. The continuous violence has claimed the lives of over 11,000 people in Gaza, with women and children comprising the majority of the casualties. The impact on the healthcare system is exacerbating an already dire situation, leaving the Palestinian population in a state of vulnerability. The closure of Al-Quds Hospital due to a fuel shortage caused by Israeli attacks highlights the devastating toll on Gaza's healthcare system. The international community must address the urgent need to ensure the safety of medical staff, patients, and civilians. With limited access to medical supplies, food, and water, the dire humanitarian crisis facing Gaza demands immediate attention and intervention to alleviate the suffering of the Palestinian population. Now let's move on to the other info. Israeli airstrikes ravage Gaza, devastating Al-Shifa Hospital's cardiac ward. Israeli airstrikes in Gaza have left a trail of destruction, claiming the lives of numerous individuals and obliterating the cardiac ward at the main hospital, Al-Shifa. As the conflict rages on in the besieged strip, Gaza officials report the 37th consecutive day of fighting. The ongoing tragedy and loss of civilian lives have drawn condemnation from the United Nations Development Programme, UNDP, urging an immediate end to the conflict. Al-Shifa Hospital, surrounded by Israeli forces, faces a dire situation with thousands of medics, patients, and displaced individuals trapped inside, grappling with power outages and dwindling supplies. On Sunday, Gaza officials reported that at least 13 people were killed in an Israeli airstrike on a home in Khan Yunis. The day prior, the United Nations Development Programme revealed that several individuals were killed and injured in a strike on a UN compound in Gaza City, where hundreds had sought refuge. These tragic incidents underscore the urgent need for a resolution to the conflict, as innocent civilians bear the brunt of the violence. Israel's offensive intensifies near Gaza's primary medical facility, Al-Shifa Hospital, where health officials warn that thousands of medical personnel, patients, and displaced individuals remain trapped without electricity and essential supplies. Mohammed Abu Salmiya, the director of Al-Shifa Hospital, expressed grave concerns about the patients in the ICU, stating that lack of electricity and fuel puts their lives at risk. The hospital has repeatedly come under attack as Israeli forces allege Hamas fighters are using it as a command center, although no evidence has been provided to support these claims. Eyewitnesses within Al-Shifa Hospital recounted a night of violent fighting that enveloped the hospital. Gaza officials confirmed that one Israeli airstrike destroyed the hospital's cardiac ward, exacerbating an already dire situation. The lack of electricity resulted in the shutdown of incubators in the neonatal unit, endangering the lives of approximately 40 babies and cutting off ventilators for other critically ill patients. Doctors Without Borders surgeon, Mohammed Abaid, shared an audio message on social media, reporting the tragic deaths of 2 infants due to depleted power in their incubators, alongside the death of a man when his ventilator ceased functioning. Al-Shifa Hospital, one of the few operational hospitals left in Gaza, is now out of reach for newly wounded individuals, according to Dr. Mohammed Kendall from Nasser Hospital in Khan Yunis. The dire circumstances have prevented ambulances from evacuating patients to Al-Shifa, leaving the hospital effectively incapacitated. The Israeli campaign, which began on October 7, has resulted in the loss of thousands of Palestinian lives, including a significant number of children. Infrastructure has been decimated, and over 1.6 million Palestinians, comprising over 70% of the enclave's population, have been displaced, leading to dire humanitarian conditions characterized by overcrowded outdoor camps and a desperate need for basic necessities. As Israeli airstrikes continue to devastate Gaza, Al-Shifa Hospital stands as a grim symbol of the conflict's toll on innocent lives. The destruction of the hospital's cardiac ward and the ongoing power outages pose an immediate threat to the lives of patients and medical personnel. Urgent action is required to bring an end to this protracted conflict and provide the necessary aid and support to the displaced population. The international community must rally together to address the humanitarian crisis unfolding in Gaza and work towards a sustainable solution that upholds the principles of peace, justice, and the protection of innocent lives.